At this point, what I'd like to do is go ahead and have Dr. Surgeon get on the table, and we'll do this treatment on this table here. It's a little bit different. It's a little more controlled. It's what we call a Cox Flexion Distraction Therapy. It was developed by a very prominent chiropractic physician in Fort Wayne, Indiana. He's been doing it for about 40 years. He's developed the treatment tables. He lectures all over the United States and all over the world, for that matter. And it's just been very beneficial for a specific class of condition. Okay, what we have here is a table that is similar to what we've shown on the previous adjustments, but it's just a little bit different in that it gives me more specific control of the motions affecting the back. We're still going to provide a traction to the lower back, and we're going to utilize the legs to make that traction, but we're going to use some side-to-side movement that we're not able to get on a standard table. This table also allows it to come up and down for me so that it protects my back. So we're going to start off with a straight downward pressure to just gently mobilize the joints in the lumbar spine, the lower part of the back. And as simple as this seems, in some people with very acute, severe pain, even this much motion is too painful. Are you having any pain with that, Dr. Surgener?
No, not at all.
Good. He's doing well with that. So now we're going to add an element of side bending or right lateral flexion. And we're going to bring the legs off to the right side, which obviously opens up the joints on the left side, as well as decreasing the pressure inside the disc. One of the major benefits to this table is I get to control all the motion. It's very slow and very precise. No quick rotational torque. In disc injuries, in some cases, rotational torque is the worst enemy. Now we're going to stretch it out a little longer, just increases the tension. And we're going to work our way up the spine a little bit further. So we're getting good movement, and we're increasing the tension now that things have loosened up a little bit. And all that's done at a fingertip control. How are we doing here, Dr. Surgener?
Wonderfully.
That's the idea. Now we're going to try a little bit of left lateral bending and just see how that does.
Just nice stretching.
No more restriction there on the left than the right?
No, not at all.
We haven't done a lot of left lateral flexion on this because the right seems to decrease more. And at this point, we're putting quite a bit of pressure on this. Very good. Okay. You can step right off.
Felt great.
Here again, if you look at this chart, similar to what you saw before, spinal nerves coming out from the spine, going down the legs, all around into the rib structures. And this is what we're decreasing pressure on, is these nerves and discs in these lower part of these joints.